Hey everybody, Dr. Healy from Root Healing Wellness here. Today I'm going to talk about how to shrink masses, stones, cysts, fibroids in the body. A common problem that many patients face, but that do not have good solutions in standard of care or even functional medicine. Let me give you some examples. A lot of patients have experienced things like gallstones, kidney stones, cysts, fibroids, sometimes even masses that can lead to things like cancer. So when it comes to shrinking things, what really can be done? I would argue that there aren't any really proven solutions outside of what we do outside of surgery, which is literally to excise and remove those masses from the body. So in the example of gallstones. So in standard of care, what do? You just wait until the gallstones are too big, till they block something like the biliary duct, and then they have to take out your gallbladder. So you can live without a gallbladder, that's true, but I'm going to tell you, you're always going to live better with one. Organs are there for a reason. Also, if we're looking at things like kidney stones, passing a kidney stone, believe me, very painful, uncomfortable process. If it's too big, it does have to be surgical. Oftentimes lithotripsy, or sometimes they just break it up with lithotripsy and then you kind of pass it, still very painful, or sometimes it does have to be a surgical removal. Not just that, what if you have PCOS, polycystic ovarian syndrome, and you have cysts? Or what if you have uterine fibroids? All of these can be shrunk. We literally have thousands of recorded case studies, shrinking examples of all of the different masses that we just spoke about. Most of the time this is an herbal solution. Oftentimes you're looking at about like 3 months worth of herbs, and you can have objective measures of improvement. What that means is you get a scan. You can literally see how many you have sizes, then you take products that are specially matched up for you, and then after, it's normally about 3 months. Depends on how many, how big in the patient. There's a lot of factors, so we'd still need to talk and identify these things. But then you can get another scan and you can see how much of it has shrunk. So you have objective measures of improvement. It's not something you just have to trust and believe me on. So the point of this video is to let you know that you do not need to jump straight to gallbladder surgery when you have gallstones. You do not have to go through the painful process of passing a kidney stone and getting reoccurring kidney stones. You do not have to worry about things like infertility because of cysts and fibroids and how your hormones are out of whack and essentially preventing you from living your best life. So if these kinds of conditions are things that you suffer from, or friends or family suffer from, please feel free to reach out to us. We'll do our best to talk to you in a consultation and see if you are a good candidate. Thank you very much, everybody.